Does this dress make me look fat?
For the weight assessment, first step you want to do is have your patient remove everything from their pockets. Is that everything?
No.
Is that all?
No.
Now that everything is out of the pockets, next step would have the patient remove their shoes and socks. Now that the patient's shoes and socks are off, you'll have them stand up on the scale. Make sure both feet are on top of the scale and they are well balanced. Then you are going to move the bottom weight first. So we're going to go, we'll check at 100. You're going to slowly move the top weight until this piece is even in the middle. So we'll need to go up one more. And you'll slowly move until that piece starts to move a little bit. So she is 166 on the dot. So now you can have your patient step off the scale. To measure height, you're gonna have your patient step on the scale, have them scoot all the way back, and then angle those feet out at about 60 degrees. Next, you're gonna take that horizontal bar and you're going to put it to the, ma'am, I'm gonna need you to remove your bun. Make sure you have the patient remove all buns, braids, and hair clips from their hair before measuring the height. Now that we can properly measure her height, you're gonna have your patient take a deep breath in, and you're gonna take that horizontal bar and just lower it down until it gently hits the top of the head. And then you're gonna have your patient step off the scale, and she is approximately 65.5 inches. To document BMI, you take the weight of the patient in pounds and divide it by the height of the patient in inches squared. Then you will multiply it by 703. Another calculation option is to take the weight in kilograms and divide it by the height in meters squared. The charts represent the interpretation of the BMI ranging from underweight to class 3 obesity. A few indications for BMI are that it is inexpensive and easy to perform. All that is required is a scale and something to measure the height of the patient. It can also be used to screen different weight categories, which can be an indicator for obesity or other health concerns. Contraindications related to BMI are that it is not a direct measure of body fat, but is shown to be moderately correlated with more direct measures. BMI also does not consider age, sex, or activity level of the patient. It is not able to differentiate between body fat and muscle mass. A few precautions to remember when taking BMI is to make sure the patient has removed their shoes and socks and to remove everything from their pockets. Make sure the patient is standing all the way on the scale and is well balanced. For measuring height, make sure all buns, braids, or hair clips are removed. Gently place the horizontal bar on the head so you do not injure the patient.